Hi everybody, my name is Dale Shagrin and I'm a director at Care One Hospice in Los Angeles, California. We at Care One have decided that we could do a public service, or at least a service for our fellow hospice and palliative colleagues, to provide information on how we're responding to this COVID-19 challenge that everybody has in front of them now in the world. So in hospice it's a little unique because we're entrusted to provide comfort and dignity with stability to patients and families that we serve. But we also serve the facilities where people are staying when they can't be at home during their care on hospice and palliative. So we needed to see what is the best way we can be of support to them as well as the patients and families. We first of all made sure that our staff felt protected and had support from us. We made sure that we procured enough PPE so that they're safe when they go in there. It was, as it is for all of us, a major monumental challenge to do that. But just turning every stone that we could possibly turn to find what we needed in terms of masks and gloves, gowns, etc., to protect our staff and that they could be protected and to protect the people that they're working with as well. The next situation is, of course, to be very flexible during that, to make sure that people are fluid in their schedules because people are dealing with different issues now, additional issues. So we have to be have more moving parts so that we can respond to those needs. The third component is to be proactive, talking to the patients and families, talking to the resident care directors, the executive directors, the owners of board and cares, the staff at hospitals, to find out what are the particular circumstances for this patient that we're being referred to see. What are the unique situations? Do they have COVID-19? Have they been tested? Of course, they can't go back to the facilities until they have been cleared. But still, to make sure that we're abreast of the entire circumstance and landscape for that hospital and for that patient and their family. The next part is to reach out to the facilities through a member of our emergency prepare team. We at Care One put together an emergency preparedness team back when we had fires in the area and to be prepared for earthquakes. So now the same emergency prepare team and some additional members are having a very important role with the COVID-19 crisis. We've developed a particular member of that emergency prepare team, we call a liaison, to be assigned to each facility that we serve so that they can proactively be in touch with them so we can find out what are their needs, what are the needs for their staff that maybe we could help them with supplementally. We've even done things like bringing them lunch, of course not going inside and exposing anybody, but leaving things outside at a distance, much like a DoorDash would do, wearing our masks and gloves, providing pizza and lunch for them and coffee and things like that, which has been really well received. Just making their job easier so they can focus on the patients and families that they serve. The next part is to reach out to the families themselves because, as we all know, the families are not able to have free access to the patients anymore. They're in a sense quarantined, so we've taken an extra step and we've provided additional calls. We've assigned people that are familiar with the case, usually a nurse, to contact those people pretty much on a daily basis now. So these are some of the things that we at Care One are doing to go the extra mile during this crisis. We want to be there as a leader to help people have an extra resource to deal with this pandemic. And that's the message that we have out there for today. We're going to put some other sort of public service messages out there on some of the things that can be done in terms of to compensate for the lack of social contact, physical contact that we can have with people that we love in the next video that we're doing. I hope this proves to be helpful to all of you out there. Thank you so much.